My name is Esther Castro, and I'm the Chief of Diversity here at Pre-Health Shadowing. And it's great that you're all here today. So just a PSA, we do have closed captions for all of our live sessions. This is to accommodate students with disabilities, and we want to be inclusive to all. So if you do have other recommendations on how we can become more inclusive, please email us at info@prehealthshadowing.com. We are constantly looking to grow. Since this is an international program, we want to know more about where you're coming from. Go ahead and drop in the chat where you're zooming from today. Awesome, we've got people from all over the country, all over the world, wow. If you would like to stay in the loop and keep up with Pre-Health Shadowing, make sure to follow us on social media. We are active on Instagram and TikTok. And if you would like to get regular updates on when our live sessions are, you can subscribe to our email list at prehealthshadowing.com. So we have some wonderful opportunities for you all and that we would like to draw your attention to. So first, we have partnered with Kaplan to get you guys a 10% discount code that can be used on all Kaplan products, as well as free resources. This includes study guides, prep questions, and other things to help you prepare for standardized tests, such as NCLEX or PCAT. If you fill out our short survey, which we have just dropped in the chat, you'll get hooked up with these great resources, and it's an awesome opportunity. I recommend checking it out if you're preparing for any kind of professional school. So we would also like you to take a look at the Fem Health Summit. This is an amazing year-long program featuring 19 women professionals from various fields of medicine that have been pioneers. It includes one woman who was on Shark Tank. It is pretty cool. If you want to connect with them and be a part of this amazing experience and just get to see them talk about their different opportunities, what they've experienced, and get their recommendations on applications to med school or whatever professional program you are going to look into, we highly recommend you follow the link in the chat to reserve your spot today. This, for a limited time, is $29. It is usually a $49 value, so be sure to do that soon. If you are not feeling the discount, we are doing a giveaway. We have a couple scholarships for the Fem Health Summit that have been generously awarded to us, and we want to give it to you guys. So if you want to get in on this, you can submit a 350 word or less essay or a 2-minute or less video answering the prompts on the screen. And there's a link in the chat. It is an awesome opportunity, and it also lets us learn more about the student population that we are serving. So if you want to get into the Fem Health Summit, which is a year-long event with all of these great resources for pre-health students, please apply today. So something else we would like you to look at is Masks for Masks. Masks for Masks is a woman-led organization that for every 4 masks they sell, they donate 4 masks to a person in need. This could be healthcare workers, people from the homeless population, people all over the world who are struggling in the midst of a global pandemic to protect themselves and stay safe. This is just a great message, and it's such a great opportunity to give back a little bit, but also do something for yourself. So if you use the code PHS15, you can get 15% off your order, plus 10% of the proceeds will go to PHS, which is great because we are, like I said, a student-led nonprofit that is run solely off of volunteers. So we can use all the funding we can get to keep our program free and accessible to all. If you are interested in becoming part of this team, you can join us by following the links here, and they will be dropped in the chat. You can become an asynchronous volunteer and just work at your own pace and do what you can with a couple of tasks a week, or just as many hours as you would like, and you'll get verified hours for just helping us out, helping run our program, helping connect with students, professionals. It's a great way to also network with your peers and kind of get to know people who are going into the same field as you. If you want to do even more and get up here with us, you can apply to become a team member and have a more administrative role in pre-health shadowing. We are welcoming applications and would love if you could join. So if you are a high school student, we have opportunities for you too. If you were looking to get some more experience, boost those college resumes, or even apply to a guaranteed admissions program, this is a great thing to put on your resume. You can get involved by also following the link for a volunteer and being sure to specify that you want to be involved in the HTP, which is a high school training for pre-health shadowing program. This will allow us to establish pre-health shadowing as a club at various high schools throughout the US and allow for students to get involved in taking on medical projects, internships, and different fundraising volunteer opportunities for healthcare just before they get to college. So if you are interested in getting published, we also have an opportunity for you. You can follow this link and submit writings, reflections, success stories, or reviews from either our live sessions, from just your own self, maybe some research that you have written up for a class. You want to submit your paper and get published. This is awesome to go on your CVs, cover, you can go on your resumes, applications. This is going to look great on you, and we want to support student writing, student education. So we'd love to hear what you guys are interested in, what you guys have done, and or even just like how COVID has impacted you. So we'd love to hear from you. Our editor-in-chief will look over this and can give you feedback on your writing and publish it on our website. So as I've mentioned before, Pre-Health Shadowing is a student-led organization that runs off of volunteers alone. So we are all dedicating our hours and our days as full-time students to keep this program running and free and accessible to all of you. But the website isn't free, Zoom isn't free. We have to put in a lot of money and time and effort. So if you can, we ask humbly that you either donate to us, send the link to somebody who you think can donate, or become a volunteer with us to help support our program. So throughout the session today, we encourage you to drop your questions in the chat. Our student team will be copying and pasting those questions into a document, so we are keeping track of them to ask our speaker during the latter half of the Q&A session. Make sure to take good notes because there will be a post-shadowing assessment available to take after the session today in order for you to earn a certificate verifying your virtual shadowing hours. There will be more information about this at the end of the session, so stay tuned. And just a final note, we request that you put your cameras on if you can and if you are comfortable. We know that it's not always possible, but we do like to encourage a more communicative environment and just make it feel like a real shadowing experience. So with that, thank you all. And we're going to get started with our session today. Dr. Agnese, you can go ahead and share your screen.
Sure, thank you. Let's see. Okay, hi everyone. My name is Tracey Agnese. I am a pediatrician. I am going to just minimize this little view here so I can see all my slides. There we go. Okay, so I'm an MD and I am an IBCLC, which is a board certified lactation consultant. I'm a pediatrician, outpatient pediatrician in New York City at a private office on the Upper West Side. I have a website. I am new to creating a social media presence as well with some education, and we'll talk about all that through my presentation. Okay. Okay, so I am a partner in a group practice. There are 6 partners. We have 3 employed physicians. We have 2 nurse practitioners. I realize that doesn't add up to the profile on the side here. We have a retired doctor as well. He was a partner and he is retired, but he still works for us sometimes when we need him and he wants to. We have 2 offices. I only work in the Manhattan office on the Upper West Side of Manhattan, but we also have an office in Scarsdale, which is a suburb up to the north. Between the 2 offices, we have about 20 staff as well. We see patients from the first visit when they're a newborn through college and sometimes beyond. We actually have patients who wind up going to grad school in the city, and we kind of keep them sometimes as well. But we are pediatricians. We have 2 hospital affiliations, one at NYU Langone Medical Center and one at Mount Sinai, which again, I think later on I go into what that really means for us. And I've been practicing for about 10 years or so in private practice, and I absolutely love it. I love what I do. Recently, I started to share education online and social media. So I started a YouTube channel and an Instagram account. I call myself a baby doc mama, and I provide educational resources for the 4th trimester, which a lot of people haven't necessarily heard of, but you have 3 trimesters of pregnancy, and then a pediatrician, Dr. Harvey Karp, I think coined the term the 4th trimester. And that's the first 3 months after the baby's born of the baby's life, but also the mom is adjusting to being a new mom, and a lot goes on during that time, and it is overwhelming. So I'm creating some online education for moms on how to take care of the baby, but also how to take care of themselves during this time. Okay, so how did I get here? I did my undergraduate at University of Delaware. I majored in biology and I had a minor in Italian. I then went to the State University of New York, SUNY Downstate in Brooklyn, where I did my medical school, and I did my residency at NYU in pediatrics. So if you look at this nice little timeline I have here, you'll notice that I am missing 2 years there between undergrad and grad and medical school. And we'll talk about what I was doing during that time. So this was actually really fun for me. As I was creating these slides, I found a folder of personal statements that I wrote for medical school and residency, and letters of recommendations from doctors along the way. And it was really fun to actually kind of go through it. And I started off as a kid wanting to be a pediatrician. I remember going to garage sales with my mom and buying stuffed animals and thinking, I'm gonna put these in my office one day when I'm a pediatrician. So I always thought that that's what I wanted to do. And I, did the track. I went to undergrad. I did all the pre-med stuff, the clubs. I was actually in a club called Clowns for Medicine, which I was only in briefly. And I find myself talking about it more than I talk about a lot of other things. People are always interested in it. Came up too along every interview process along the way. People would ask me, what is that? Which is a funny thing, because at the time I didn't even really realize that I would talk about it forever, but it was fun. We dressed up as clowns and we went to hospitals and different places, spreading cheer or whatever. It was fun. I did a lot of shadowing, as you all know, and that's probably why you're here. I shadowed my own pediatrician. I shadowed family medicine doctors in my town. I shadowed a plastic surgeon that I knew of. I don't have any doctors in my family, by the way, either. So all this stuff I just found on my own, people to shadow, because I thought that that's what I wanted to do. I don't have anyone in my family in healthcare at all, actually. And I volunteered. And a lot of my essays, personal statements, things I wrote about along the journey came from these clinical experiences that I had, which again, at the time, I didn't even really realize. I volunteered in the ER. I think that was the first thing I did. And I wound up writing my personal statement for med school, I think, about me. I had to track pain levels of kidney stone patients. It was a study on treating kidney stone patients with pain medicine. And so there I was, I knew nothing. And they just said, here's the piece of paper, have the patient fill out their pain level from 0 is no pain to 10 is the worst pain. So I had to do this on people with kidney stones who are in a lot of pain. And part of the study, they had to actually circle it. So I had a clipboard and I had to have these people who were screaming in pain, and they're like, a 10. And I'm like, yeah, 10, can you just circle for me? Like, you have to circle it, I can't. And so I think I wrote that in an essay somewhere, but, and I had various jobs all in medicine. University of Delaware, we large winter sessions. So over summers, over winters, I got jobs in different doctor's offices. And I wound up doing it through a temp agency at the time, actually. I made a good connection at this temp agency. And then anytime I had a large chunk of time off, she would put me in with a doctor's office that needed someone. So it was a good exposure. So I was totally this pre-med route. I knew I wanted to go and be a doctor. But when I went to college, my uncle, he promised that if I learned Italian because my whole family is from Italian descent. He promised if I learned Italian, he would take me to Italy to study Italian because he thought it was important that I learn about my heritage. So I had no interest in foreign languages, learning it at all, but I thought I would be silly not to take him up on this trip to Italy. So I enrolled in an Italian class and he took me to Florence for a summer of my freshman year of college. And I just fell in love with it. I fell in love with learning the language. Again, I had been so one-tracked with just biology, medicine. I didn't really think about any learning about other things. And I really loved it. So I wanted more, and I wound up doing a winter session in Italy. And then I wanted more, and I wanted to go for a semester. But I knew at that time that if I was going to go for a semester, I was going to be delaying my whole medical school application process because it was around the time I would be studying for the MCATs and taking them. So it was a big decision that I had to make. And ultimately, I decided to go to Italy because I really wanted to. And I was fine with either delaying or not going to med school if that's what came of it. And at the time, I thought, I don't know what, I thought, I know what doctors do. I know what teachers do, I know what policemen do, because we all see them around, but I don't know what anyone else in the world does as a job. So how do I know that I really, just want to be a doctor? I kind of wanted to find out more. So I went to Italy for the semester and I put off med school. So when I came, after I graduated from college, I actually forgot about some of these jobs. As I was going through that folder, I had some small, very short amount of time here and there at these pharmaceutical company. And I did wind up becoming a clinical research associate, which was the largest chunk of this time. So I was a liaison, and I thought this was going to be perfect because it was travel and I was still kind of somewhat in medicine. So I was a liaison between pharmaceutical companies and the principal investigators. And those principal investigators are doctors around the country who are enrolling patients in the clinical trials to study a drug. So, AstraZeneca, Pfizer comes out with a new drug. They need doctors in their offices to be the ones giving the drug. And this is where you get into different phase of clinical trials. We mostly work with phases 3 and 4, which where you have a new drug out and you're comparing it against the standard of care drug that's out there. So my job was to go to these doctors' offices and review their charts and make sure that they were capturing all the information they needed to be capturing, that they had all the consents documented properly, that they were following the study protocol. And I traveled around the country to different doctors' offices to do this. So I thought it was perfect. But in reality, I realized that it really wasn't perfect, that I was sitting there looking at these charts and I really wanted to be with the patient. I wanted to be the one talking to the patient, figuring out what was going on with the patient. And I actually remember quite clearly, I don't even know where I was, in an elevator in a hospital somewhere. And I had my little bag of all my stuff that I needed to, check documents. And I remember some doctors in the elevator talking, and I just thought, no, that's what I want to be doing. I want to be talking about patients and seeing patients. So that is when I applied to medical school. So for medical school application, I wanted to point out that, letters of recommendation are a good, it's a way to let yourself shine, your personality, and with the letters of recommendation, nothing else is important. I hadn't done any research. Your grades are not important when it comes to the letter of recommendation. It's really a way for the schools to know who you are, your personality, your work ethic, your rapport with colleagues and patients, and that any point along the way, of your journey of finding out what you want to do in healthcare or anything, you don't know who it's going to be that you're going to have that connection with, or ultimately wind up asking them for a letter of recommendation. So I think it's important to try to just treat everybody everyone along the way, like they might be someone who will write you a letter. And even if it's not someone you directly ask for a letter, it might be somebody that someone else asks their opinion on you when you're applying for a position, a job, or something one day. I actually had this come up where one of the final attendings I had on a pediatrics rotation in my residency was someone I did not ask for a letter of recommendation for. At that point, I was already applying for jobs to be a pediatrician, a general pediatrician. And I didn't know at the time, but where I currently work, all of these doctors that I was applying for a job with, they knew him very well, and they reached out to him and asked how I did on that rotation, what I was like. So you never know. It's a small community within medicine, and so you never know who knows someone, and they're going to ask about how you are. So whatever you do along the way, I would just say, show up like you're going to be asking that person to write you a letter, or that someone else will be asking about you. As a letter writer as well, I think it's important to know that the people, when they do write letters about you, they're always trying to think of like a story, or at least a good letter writer is trying to think of a story to kind of express how you were when in that time you were together. So you never know really what they're watching. This is a letter I found in this folder where, it was a doctor it was an oncologist, and it was a temp job that I had. And he, knows nothing about my grades or anything here. And he honestly really doesn't even care. But the things that I highlighted, he says, easy rapport with our patients, that I, gave the patients a feeling of competence and efficiency. And I brought a light sense of humor to the staff with an excellent work ethic, genuine interest in patients, which I really was interested when I was there. And then he tells this little story of how we were that he actually called me down to the OR. He says one case in particular in the OR took well over 4 hours. And at times in the past, when I had visitors in the operating room, I've noticed their attention frequently wanders, particularly when they're not completely familiar with the procedure. At this point, I was just in college. I wasn't even in medical school. He says, I noted quite the opposite with Tracey. She observed intently the procedure and had a very long, intelligent conversation with the anesthesiologist. She was clearly interested and seemed to demonstrate a clear aptitude for medicine. So, if you are interested, then show your interest, and that really gets you a long way. So I was accepted to the Philadelphia College of Osteopathic Medicine. I was not accepted initially. I was on the wait list there. I wrote letters once a month to the admissions committee, basically like my own mini personal statements, expressing my interest and telling me why they should pick me and let me in. And they ultimately did let me in. So, never give up, I guess, is the point of that. Okay, so choosing pediatrics. I thought I wanted to do pediatrics, like I said initially, but in med school, I thought maybe I would want to do OBGYN instead. Maybe I want to do adolescent medicine. And ultimately I figured out that even during the OBGYN rotation that I, first of all, was not interested in surgery. And second of all, I was much more interested in when the baby came out than what was going on with the mom. And so it's kind of a process of elimination sometimes during medical school, where you cross things off and then you find who you fit with, the personalities of the people and who you just enjoy talking to about what they're doing. In residency, I debated between going into general pediatrics or adolescent medicine. But I ultimately realized I really like all ages and a little bit of everything. I didn't want to specialize in one thing in particular. I like mostly well kids, not sick kids. I knew I didn't want to spend the rest of my life in the hospital. I wanted to be, more of an outpatient setting. I wasn't sure if I wanted to do private practice or not. So and at the time, there was not a lot of exposure that we had in residency to private practices. Most of the training was, all in the hospital, in the clinics. So I created my own private practice elective. I asked my program director, if I could do that. And she said, sure. And so I spent a week at 4 different outpatient pediatric offices in the city. And I arranged it myself. And it was great. It really helped me figure out what I ultimately wanted to do. So again, here's my practice. There's a lot of different parts of it that's not just taking care of patients. I do want to stress that in my session today with everyone is that medicine is changing and has changed a lot. And for the most part, no one teaches you the business stuff in medical school. But the earlier you learn that you have to learn that stuff and that you should, and it's in your best interest to learn that stuff, the better. Because most of us right now didn't learn that until way too late. But it's a business. There's different parts of the business that we partners, every practice does it differently and splits it up differently. Some have a managing partner who takes care of most of everything. we split things up. I mostly do the HR. I do the staffing, the hiring, the firing, the reviews of our employees, raises, manager meetings. And we have someone who does the finances, works with our accountant and bookkeeper, does payroll and bills, and looks at our revenue. We have someone who is in charge of the billers. We do our own in-house billing. Not everyone does that, but we negotiate, you know, that person negotiates our insurance contracts with the lawyers. We have one of the partners is in charge of the lab and maintenance and all the certifications. One of the partners does our schedules, which is a big undertaking as well. And then somebody does our website and our social media and marketing. We all wind up talking to vendors and, you know, doing stuff that you don't think of as medicine, but it really, if you don't have a functioning practice, then you're not able to actually practice medicine. So what is a typical day like in general outpatient pediatrics? I'll have to do pre and post COVID here because things are very different, but pre-COVID, we used to round at hospitals. So I told you we were affiliated with NYU and Mount Sinai. We also used to be affiliated with Lenox Hill. We gave that up. It was just a little too much a few years after I started here. But our affiliation with those two hospitals means that we round on our own patients there. Mostly it's newborn babies. So the baby's born, and if there's anything urgent that needs to be addressed, the NICU, the neonatal ICU doctors or residents will address that when it happens, you know, when they need it, because they're physically there. But if it's a baby who is well, then the pediatrician needs to check out the baby within 24 hours. So we would go to the hospital in the morning to see any of our patients that were just born at those hospitals. We also used to admit our own patients to those hospitals and take care of them if they were on the inpatient floor, mostly taking care of things like you know, child maybe that had an asthma attack and needed to stay in the hospital. And we would round on those patients as well. We don't do that anymore. We stopped during COVID because I think most everyone did, or maybe not everyone, but it just didn't make sense to be going in and out of hospitals when you didn't have to and there were doctors there. So we don't do that anymore. We mostly see a lot of well visits, well checkups, you know, and we also see sick visits. We used to pre-COVID have walk-in hours in the morning from 8 to 9 a.m. and then again from 6 to 8 p.m. We don't have walk-in hours anymore. Of course, everything is scheduled and it's different, but we have to keep same-day sick appointments available. We are open every day of the year, weekends and holidays as well. We generally, I would say most outpatient general pediatricians see around 20 patients a day. Some days it's a lot more than that. Some days it's a lot less than that, of course, depending on your hours that day, but that's I would say about average. And then we take call, and being on call is different, of course, for every specialty. For us in pediatrics, in outpatient pediatrics, it means that when the office is closed, we get phone calls from parents who are concerned about something. And we have a nurse triage service that actually does take the calls first, and they call us if they need a backup or if the parent just wants to talk to the doctor. All right, so let's see, I'm checking my time here. Okay, I think we're pretty good. I'm gonna do a case presentation on like a newborn visit in the office. I took this from an actual patient that I saw January of this year. So the babies generally, again, pre-COVID, and post-COVID are different, but pre-COVID, the baby would, if it's a normal vaginal delivery, the baby would stay in the hospital 2 days and then go home. If it was a C-section, they typically stayed 3 days and then they would go home. And they would come see us for the first visit in the office, usually about 2 days, 3 days later, sometimes the next day if there were concerns, but usually within 3 days. Now with COVID, the hospitals are trying to get the patients out sooner. So sometimes the vaginal delivery babies will go home within 24 hours and the C-sections maybe 2 days. So then we're seeing them in the office a little sooner as well. So this baby you can see is 4 days old up here. And there were no patients and important on New Year's Eve. NSVD stands for a normal spontaneous vaginal delivery. So it was not a C-section, it was a vaginal delivery. GBS positive, that's really important to us in pediatrics. GBS is group B strep, which is a bacteria that is a part of the vaginal flora of many women, and it doesn't cause the woman harm, but it can be a bacteria that gets transmitted to baby and can make the baby very sick. So women are screened for this colonization of bacteria around 37 weeks of gestation of the baby. If they are positive, then they are instructed to get to the hospital as soon as possible once they have a ruptured membranes, meaning that they're going to have the baby soon, because they need to get antibiotics. The mom needs to get an IV dose of antibiotics. And we, as pediatricians, we look to make sure that the mom did get a dose of antibiotics at least 4 hours before the baby was born, if this is a vaginal delivery, because the baby's coming out of the tract where this bacteria is. In this baby was not, the mom was not adequately treated. So that is important for me to note here in the history, that mom only got 1 dose of antibiotics, but it was less than 4 hours prior to delivery. So in the nursery, in the hospital, this baby got phototherapy, the SP, status post phototherapy, in the nursery for about 12 hours. We're going to talk about this a lot more in the next few slides. So I'll kind of leave it at that, but it's jaundice, and that's what we're going to talk about. The baby's birth weight was 6 pounds, 4.1 ounces. Discharge weight was 5 pounds, 8.3 ounces on January 2nd. Seeing this baby on the 4th. The gestational age was 37 weeks and 4 days. So full term is 40 weeks. This is a 37 week, 4-day baby. So that also becomes important with the bilirubin. The APGARs were in 9 and 9, which we'll talk about in another slide. Breastfeeding. So mom was doing what we call a triple feeding plan, where she was feeding 10 to 15 minutes at each breast. And then afterwards, she was giving a bottle of EBM, which is expressed breast milk, or formula, about 30 to 60 milliliters, which is about 1 to 2 ounces every 3 hours. She was also pumping. So this is a lot of work for the new mom. The baby had about 5 diapers in the last 24 hours, and the poops with the BMs were getting lighter. Poops start off really thick. Tarry dark meconium is the first poop that the baby has. And then as the baby starts taking in breast milk or formula, the poops start to get a little bit later. Newborn screen is pending. This is a blood test that the hospital does. It's a heel prick blood test that they do, and they send it to the state to a test for 40 or more metabolic diseases. Every state has a variation of different things they test for, but it's a requirement done at the hospital. And it takes about 2 weeks to come back. Hearing screen is also done in the hospital, and this baby passed in both ears. And this is important, we'll talk about this as well, is the blood types of the mom. The mom is O positive and the baby is B positive, Coombs negative. Family history, medications, and the baby was not on any medicines, and we don't know of any allergies yet in this first 4 days of this baby's life. So here's just a little more. I guess I want to talk about the APGAR scores. They are a score that's given to the baby at 1 minute and 5 minutes of life, and it tells us how the baby is doing. A perfect score is 10 and 10. No one gets that. It's actually kind of a joke in medicine that the only babies who get that are babies of pediatricians, because no baby really gets a 10 and 10. And 8 and 9 is a really great score. But what we look at is how the baby is when the baby comes out of either the uterus from a C-section, or comes from a vaginal delivery. That at 1 minute of life after the baby was born. How's the baby doing? So a baby who over here is like pink all over. So you get different points. You can get up to 2 points for each of 5 different things here. Okay. So appearance is the skin color. So a pink baby is what we want to see. That baby gets 2 points. A baby who's totally blue or pale gets 0 points for that. And right in the middle, where sometimes you'll see the baby, a peripheral cyanosis, which is where the hands and feet are blue, but the pink, but the baby's pink in the body, in the chest, and that gets 1 point. Pulse is over 100 is a good, strong newborn pulse. Babies have much higher pulses, heart rates than we do. And a 0, of course, is not a good pulse. And so that you get no points for. Somewhere in the middle, you get 1 point. Grimace is how the baby reacts to a little bit of stimulation. So by stimulation, it can be a little bit of a pat on the back or rubbing the finger, the hands or the feet. Because sometimes babies come out, we call it stunned, and they're just not doing anything. They're not breathing. They're not doing anything. If you pat that baby on the back, or if you stimulate that baby and you get a really good cry, then you get 2 points. If you just get a weak cry, you get 1 point. And if nothing happens, you get 0 points. Activity is the muscle tone, how the baby's doing. A baby that's like flexed up like this, or active movements of the arms and legs is moving around, that's great, that gets 2 points. A floppy baby who's just like real loose gets no points. And then respiratory effort. So a baby who has a good, strong cry, is breathing really well, gets 2 points. A baby who's not breathing at all gets none. And if you have a weak, slow, irregular respiratory effort, then you get 1 point. So those are APGARs. The blood types. So this becomes important because this case we're going to talk about jaundice, and blood types are important when we talk about jaundice. So there's 4 blood types people can have. You can be A, you could be B, you could be A, B, or you could be O. It's determined based on proteins on the surface of red blood cells. There's also an RH protein on the surface of red blood cells that can either be positive or negative. So these proteins are all potential antigens, which is a foreign substance. So it's a potential for your body to react to in a bad way, and basically like attack. So we all have antibodies in our bodies for protection, and these antibodies can cross the placenta and attack the baby's red blood cells. So maternal mom's antibodies can attack baby's red blood cells if there is what we call a setup, right? So it becomes important for jaundice. There's a test called a Coombs test, and that actually checks for this attacking, blood cells. So in our case, the mom is O positive. Okay, you could see here the mom is O positive, the baby is B positive. So this is a setup. Mom has antibodies against the baby's B blood. So it is a setup for a little bit of what we call ABO incompatibility. Okay. So this baby's birth weight was the weight in the office when I saw the baby was 5 pounds, 8 ounces. And this is my exam here. We go from head to toe. That's kind of how pediatricians check out the baby. I think most of us all do it in really that way, where we just look at the baby, well-developed, well-nourished, baby moving around, baby looks pink or yellow or good color. You check the head, make sure it's like normocephalic, so correct shape head. There's a lot of different sutures in the head. So there's all these different, bones that are not set in place yet in a baby's head. And that's on purpose, because the baby needs to be able to get through the vaginal canal. So these bones can shift around. And then there's an opening, the soft spot on the top of the baby's head right up here. And so that's an open spot where the bones are just not all fused together. Again, it's good. It allows room for growth of the brain, and it allows that baby's head to kind of shift and get through the vaginal canal. So we're always checking the head. We're checking to make sure that the fontanelle, that open spot up here, is flat and that it's open, and that there's no bruises or bumps or abnormal shape. We check the eyes with our ophthalmoscope. We make sure there's a red reflex in there, which is that like red light that you get with or you don't get that anymore with wonderful phone pictures, but old school cameras, you used to get those red eyes, and that's actually a good thing, because that means that the baby has a healthy eye without anything behind it, like a tumor or increased pressure or something worse. So we check that. We check the ears, make sure they're in the right position, make sure the nose is in the right position, that it's not deviated, that the nares are open and patent, the oral cavity that looks moist and normal, that sometimes we take a gloved finger and stick it in the baby's mouth, make sure there's a good suck there. We check the neck, make sure that it's, that it's soft, that the clavicles feel normal, that they didn't get broken during delivery, which happens. We of course check the baby's skin color, right? So this baby was jaundice, meaning yellow, down to about the calves. As baby jaundice gets worse, it kind of travels down from the head to the feet. So this baby was pretty jaundiced down to the calves. The heart, of course, we listen to the heart, we listen to the lungs, we check the belly, make sure that the belly button is, the stump is attached, that it looks okay and doesn't look infected. We check the back, make sure there's no dimple, or if there is, sometimes above in like the butt crease, babies can get a little bit of a dimple, which can be normal, but we like to make sure we can see the bottom of it, that there's no indication for spina bifida or an abnormal development down there. We check the genitalia, make sure that everything looks normal. Check the hips, make sure that the hips are in place. Babies can get it with something we call a developmental dysplasia of the hips, where the hips get out, move kind of in and out of the sockets. So we check for that. We check the pulses, we check the extremities, make sure NAE, moving all extremities equally, that there's no asymmetry, and that they, are responsive to as they should be for their age. So this baby is a big thing in pediatrics in the beginning is hyperbilirubinemia, right? So that's a buildup of bilirubin in the blood, and that causes jaundice, which is the yellow color of the skin. So everybody has a little bit of bilirubin in the blood. You and I do. We all have a little bit, but our bodies do a good job of getting rid of all the excess bilirubin that we don't need. Bilirubin is a byproduct of red blood cells. So as red blood cells turn over, which they do in adults, it takes about 120 days for your body to go through a cycle of a red blood cell where you get rid of the old red blood cell and you make new ones, and that's normal. So bilirubin is a byproduct of that. And then your body does a great job of taking care of and getting rid of the excess bilirubin. There's a lot of reasons why babies have a buildup of bilirubin. They have more red blood cells than adults. They have a faster red blood cell turnover than adults. They also have some immature livers, so they don't clear out the bilirubin as well. And another reason can be in this beginning is weight loss and dehydration, which causes decreased clearance, flushing out of the bilirubin. So, and this is the brain over here, because the reason we want to know if there's too much bilirubin in the body of a baby is because if there is too much, if it crosses a certain threshold, then it can cause brain damage. So we like to intervene way before that would happen. So we use this nomogram, which is a chart that has a different threshold for literally every hour of life in the first week of the baby's life, a different threshold that will tell us how much is too much. And these thresholds are to intervene way before we would have any sort of damage to the baby's brain. And there's different risk factors, and we'll see where our baby fell on this in a minute. So this baby was 12% below birth weight. All babies, most babies lose weight after birth, and then they gain it back. We like to see them gain it back by about 2 weeks of age. We allow them to lose up to 10% of their birth weight. And that usually coincides where they lose weight. You see this baby birth weight was 6 pounds, 4.1 ounces. Discharge weight on the second day of life 2 was 5 pounds, 8.3 ounces. And then on day 4, when I saw him, he was 5 pounds, 8 ounces. So had lost a little bit more weight. We usually like to see babies starting to gain weight again, somewhere between days 3 and 5. And that usually coincides when a mom's milk is coming in if she's breastfeeding. And this baby was still losing weight, but also was above that 10%. So was losing too much weight. And so I checked the bilirubin level, and I used the graph to find the threshold for what would be too much. And at that time, when the baby was in my office, I definitely talked to them about what was going to happen if it was too high, because I thought the baby was pretty yellow and had lost a lot of weight. And we talked about where the baby would go, because of course in pediatrics, you're not only dealing with the baby, but you're dealing with the family who's taking care of the baby. So we had to talk about where they were staying, of course, in the pandemic as well, and where they would go. And I also did a lactation consult with the mom in the office that day, trying to help her with the latch, but also letting her know she definitely needed to be coming in. Okay, so our baby had, you could see, some of my stuff. Okay, so for 95, took the baby's blood, and that's why the birth time is important. This baby was 95 hours old. And so the cutoff here, this baby was a medium risk baby, because remember, the baby was not completely full term at 40 weeks. So the baby was 37 weeks and a few days. So that's this middle line here. So for 95 hours, for a medium risk baby, the cutoff for phototherapy, which is the treatment of jaundice, which is the bilirubin being too high, is 17.4. So this baby's was higher than that, 22 point something up here. So this baby did have to be admitted to the hospital. So I did the blood test in the office. We sent it to the lab. I got the results back in the afternoon and called the hospital to set up for a direct admission to the hospital, called the family, and they went straight to the hospital. Baby got put under phototherapy lights, which are these like tanning bed kind of lights here. And that is the treatment for it. It brings the bilirubin down. It basically it just helps the body to break down the bilirubin. And then in the hospital, they monitor the baby's bilirubin, make sure it's coming down, which it usually does overnight. And it did that for this baby. They helped her in the hospital as well with pumping and feeding the baby. Okay, I think I'm kind of don't have that much time, so I do want to leave some time for questions and answers. So I'll try and go quick here. Well visits, we do growth and development. We follow growth charts in pediatrics. We make sure they're meeting all their milestones, physical, emotional milestones, language, gross, fine motor. And we like to look at these lovely growth charts to see that they pick a growth curve and they stay with it and they don't fall off of it too much or go too much in the other direction. We talk about school and exercise and sports, and we give a lot of what we call anticipatory guidance in pediatrics, where we let them know what's going to happen next developmentally. In teenagers, we do assessments of we would call this HEADS assessment, which I have here. And we do vaccines. These are the vaccines. This is from the CDC. We follow the CDC schedule, and these generally coincide with the visits that they have to have here in the office as well, where we see them at birth a few days after. We usually see them at about 2 weeks to make sure they got back up to birth weight. 2 months, 4 months, 6 months, 12 months, 15, 18 months, 2 years, and 2.5 years, and 4 years, and then usually annually after that. On social media, I am, here we go, Baby Doc Mama. I like to do a lot of this education for new moms. And as far as advice for, yeah, I think this is it. I just have 2 slides. As far as advice for pre-health students, I like to say, like, can you see yourself being happy doing anything else? Because, you know, if you are, there's a lot of easier ways to make money these days. But if you just, you know, really love medicine, you couldn't see yourself doing anything else, I think it's an amazing field. It takes a lot of commitment, but I like to make sure, you know, to say you should be committed to it. And that's part of my journey, why I shared it with you, is that I wanted to make sure I was really in it. And that helped me while I was in medical school, because I knew I really wanted to be there. Never be afraid to ask questions, never stop asking them. No question is stupid. Don't pretend you know something you don't. If you don't say, you'll find out. That is really just everything you do in life. And show interest along there. And that goes for med school, that goes for everything, you know. People tend to, you know, or, you know, how they gave up everything else. And it really, life doesn't have to be that way. There's really room for it all. But you just have to make sure that the time you have to study, you're really studying. People like to say they studied for all night, but really they like to, you know, they ate a lot of snacks, they were on their phone a lot, they talked to their friends, they did whatever. But if you're really studying for the time you say you're studying, it might not take as long as others. Business, pay attention to it early, learn it so that you can practice how you want. Contracts, negotiations, it's just so important. Doctors, we tend to shy away from that because we're not business people, but you have to be in order to really succeed, or at least be able to create the life that you want within medicine. Same goes for personal finances, learn it early. I think we tend to push it off too late, and it's never too early to start learning that stuff. Self-care, taking care of yourself throughout it, and finding your support system, you know, doesn't minimize you at all. Find who will support you throughout your journey and use it. And that's really it. I found this letter to myself that my residency program director made us write, and then she mailed it to us after graduation. So that was in the folder that I told you about, and it was just fun to read. But that's it. Like I said, I wanted to leave some time for questions. And so I'll end there.
Yes. Thank you so much, Dr. Agnese. This was a wonderful presentation. And thank you so much for like shortening it down too. We'll get right into questions because there were so many in the chat. One of them that came up was like, do you have any special training on how to speak to children about their health conditions in a way that they understand? And do you change that training towards younger children versus adolescents?
Yeah, that's a good question. So absolutely, you have to change that, you know, to the developmental stage of the kid. You don't get any special training in that. I think it's just part of your pediatrics residency. And I think a big part of it is just observing, listening to what other doctors do and taking on what you like, and creating your own style, you know. And that's part of what I really loved about my private practice elective that I did, is I got to be in the room with all these different, you know, private practice doctors in their office, not just in my clinic with that particular patient population, but in all their with all their different patient populations of socioeconomic. And that was a time where I took a little pieces of what someone said about the vaccine discussion, a little piece of what someone said about breastfeeding here and there, a little bit of what someone said about, you know, pooping and toilet training and things that they don't really, it's not medicine. A lot of that parenting stuff is stuff that you have to learn from other people. And then there was a lot of other parenting, books and whatever, that's a whole nother conversation. But I guess the short answer is, yeah, absolutely. You have to address, and a big part about pediatrics is not even tailoring it to the developmental age of the kid, but we spend a lot of time talking to parents in pediatrics. So you have to tailor it to that parent too.
Yeah, for sure. And that kind of falls into our other question. Somebody asked, because they've talked to other pediatricians and they heard that like there's a balance you have to strike between letting the patient know enough to like make an informed decision versus like not wanting to upset them. So their question came down to, how do you decide how much you let your young patients know and how much can you discuss with the parents?
I'm not really sure exactly what this question's asking as far as like maybe if there's something wrong is what they're.
All right, I guess it's
like in this.
Yeah, how do you make the decision of like how much do you actually let your patients know, or just even like how much do you let the young patient know versus let the parent know?
I mean, for the most part, the kids are always in the rooms with the parents when we are talking about stuff. So I guess I'll give an example. Like, so if, for example, if a kid is overweight and they are high on their BMI, their body mass index is high, and I'm concerned about obesity, I am very, very careful about the words that I use to talk to the kid. And I don't want to say that I think I actually don't even like to use the word weight at all much, because I've actually seen where kids can have gone the other way on the spectrum with eating disorders because of something someone, said that they didn't even really realize was so impactful. So I like to frame that. I like to show, I show the computer to the parent, and I show the growth charts and I show where they're at. But then I just talk about healthy eating and making healthy choices and keeping your body healthy and ways to do that, and take it from there. So I don't know if that really answers the question or not.
Yeah, that was a wonderful example you brought up. So thanks for clarifying that with us. Is there anything that you wish you'd done in your undergrad that you think would have benefited you more in your career in medicine?
I would say to do all the non-science stuff you can, because you get, medical school gives you all the science you need. And I know that's probably what most people like is the science. So you tend to kind of pick even the electives or the other things all based on science. But I think that if I had taken a business course, I would have loved that, or any other, maybe, if they had any sort of like contracts or negotiation or personal finance, all those things I mentioned that doctors tend to put off. I think that any amount that you can get that while you're in undergrad would be really beneficial.
Yeah, for sure. And one other question we got too was, do you think getting an MBA would have been useful before applying to medical school or even after medical school, getting that extra degree?
No, I don't. I think that we already delay our lives so much by all the degrees we get as doctors, and I do not think, and most, I think of people too with MBAs, a lot of them will say that it's really just practically doing all that stuff in reality that really is where you learn. So I don't think that getting an MBA is necessary at all.
Yeah, thanks for sharing that advice. As well as somebody had a question on your choice of school. Was there any particular reason that you chose SUNY Downstate versus PCOM?
Yeah, good question. I just wanted to be in New York.
Nice.
Yeah, family, friends, all around. So I really just wanted to be in New York.
Oh, nice. Okay, switching into kind of your more day-to-day lives. What was the most memorable case you ever experienced?
The most memorable case I ever experienced. I don't know. There's so many. I don't know.
Oh, good.
I'll pass that one. Yeah, I don't know. There's so many.
For sure. Another one was, how do you balance life? How do you balance work life as well as family?
Yeah, that's a great question. It is, I think the eternal question everybody, is wondering how to do. But I think the bottom line is know that, whatever you're doing at the moment, be present in what you're doing, because you don't benefit anybody by trying to do it all at the same time, because no one can do it all at the same time. So when I'm here at work, I'm really committed to, doing what I need to do while I'm here. Setting boundaries as far as when I am not here at work, if I'm not on call, I'm not going to be expected to answer all the emails from patients that might come through. I don't even look at it, quite honestly. If it's an emergency, they know to call the number and to be in touch with the doctor on call. This way, when I'm not on call and I'm home with my kids and my family, I can really be with them. And having support, I think that that's really important as well. Having the support so that whether that's family, friends, hired support, whatever it is, nobody can do it alone. And so you need to find out, what are the things that you really do need to be doing, and then having people help you with all the other stuff.
That's really such helpful advice. Thank you. A question we got was, do you continue to do any research as an attending, or do you mostly focus on patient care now?
Yeah, I don't do any research. I never did any research in undergrad. That job I had with clinical research was, I wasn't doing the research myself. I was, monitoring it, but that was the only exposure I really had to it. And no, I don't do any research now.
Thanks. Goes back to following your own path. All right. Another question that was, have you ever had a case that made you question being in your profession, and how did you deal with that?
Yeah, I mean, look, I think, and no matter what you do in life, whether it's medicine or whether it's something different, it's not all the parts of whatever you do aren't going to be great, and they're all not going to be interesting, and all the parts of it aren't going to be wonderful, right? Anything in life is going to have some good and some bad with it. So I think that, being happy with what you do is being able to find happiness in the parts that maybe aren't so exciting, as well. Or just, putting up with some of those parts, knowing that, you're doing it for the other things that you do enjoy,
For sure. I know, like a more relevant question for today's situation, but do you have any outlook on when COVID vaccines might be administered to children, or how that process might look?
Oh, I don't know. I can't wait. So for right now, of course, we're only giving it to ages 16 and above. They do have kids in studies from ages 12 to 16 right now. They are doing clinical trials with that. And so hopefully that will be, that data will be out there soon, and then we'll be able to start giving it to that 12 to 16-year-old group. Once we're able to give it to the 12 to 16-year-olds, then they'll start to study under that. They'll probably do, I don't know, maybe they'll do like school age kids, 5 or 6 to 12. And then they'll do the younger kids last.
Yeah, thanks for sharing that experience with us. We're out of time here. Is there any final words that you'd like to give us, as well as any advice for things that we can do during COVID to help us in our pre-med journeys?
Yeah, I mean, you guys are doing great by doing this kind of stuff. I mean, I applaud you all for being here or watching it, to keep up. A lot of people might say, I can't do any shadowing, and then just, stop, but just keep doing what you want to do. Find a way. There's always a way. No matter what the problem is, the solution was there before the problem existed. You just have to be creative and find that solution. So just follow, if that's what you want to do, just keep doing it, and just keep doing the next step, whatever that is. You don't have to have the whole big picture figured out. Just figure out what the next best thing is to do, and do it.
Yes, thank you so much. Do you have contact information by any chance on the previous slides, if you're able to go back to those?
Yeah, you know what? I have my website on the first one. It's traceymd.com. Yeah, there we go. TRACEYMD.com. So on there is, there's like a contact thing, and yeah.
Thank you so much. I just felt bad because there's people that ask questions that we couldn't get to because of the time.
Yeah.
But yeah, thank you so much for this wonderful presentation. I think we'll go into our other wrap-up slides now.
Yes, thank you so much. much for coming today. I learned a lot personally from your presentation, and I think a lot of other people did as well, just seeing what was happening in the chat. So thank you so much for giving your time to us today. For all of my students, I'm going to go over a wrap-up presentation to let you know how you can earn your certificates.
Okay, thank you, everyone. Good luck.
Thank you. Have a nice day. Okay, everybody. So let's reflect on our session today. So what brought you to the session? What are 3 major takeaways that you if you do, we would love to hear from you. If you want recognition for your reflection, then feel free to submit your thoughts and article at our at www.prehealthshadowing-blog submissions, and our editor-in-chief will take a look at it. Then you can get published on our website. It's great for CVs, applications, resumes. It'll just look good. If you are interested in becoming a part of Pre-Health Shadowing and want to learn more about our program, highly encourage you to visit our website. You can get involved with being a student volunteer asynchronously and working on tasks on your own time to get verified hours for volunteering to professional nominations and connecting with other like-minded students. We are also accepting team member applications at this time. So if you would like to take on a more active role in our team, we would love to have you. So you can be up here with us, just apply today and we'll get to know you. So once again, we are humbly asking that you donate a few dollars if you are financially able to. It costs a lot to keep this program running, and we want to keep it free for everybody. So we understand that that's not always viable, because a lot of the students that we serve are using our program because it's free and because they might not be able to afford other opportunities. So if you can, just pass this off to some people who you think might be able to donate, or you can support us in other ways by following us on social media or becoming a student volunteer. Okay, now for the time that we've all been waiting for, how to earn your digital certificate for attending and verifying your virtual shadowing hours for today. So first things first, you're going to go onto prehealthshadowing.com and sign up for free for our course for Dr. Agnese. Then you're going to click take this course and go ahead and take the assessment. It is a 10-question multiple choice quiz. You have 30 minutes and 2 attempts to take it. You just need to pass the 70% or higher. All of the questions in the quiz are relevant to what has been presented in the session today, things that she's directly said. It's pretty straightforward, pretty easy. If you're paying attention, you'll get it, no problem. Once you pass, you can go ahead and click finish course to get your to download your certificate. If you have any trouble with this, you can email us at info@prehealthshadowing.com. We do know that our website has been a little bit funky lately, and that is again because it costs money to keep it up, and we have a large influx of students that have been using it. And so once again, if you can, please donate, keep us going. But we do recommend that you wait about half an hour, 45 minutes at least after the presentation to go and try to earn your certificate in case you get locked out and the website shuts down. We don't want anyone to not be able to earn their certificate because of technical difficulties. But if you do have issues, again, email us and we'll get it sorted out for you. If you missed a part of our session today.
Sorry, Esther. Just wanted to say, if anybody just joined the session now, I really do apologize for the inconvenience of the rescheduling. This session was taking place an hour earlier. You're welcome to watch this session. It was recorded. It'll be on YouTube later tonight. And the quiz is open indefinitely. All you have to do is make an account on our website and you're able to access past sessions and watch the session, take the quiz, and earn your certificate.
Yes, thank you so much, Hannah. Like Hannah said, you can find the recording on our website by registering for the course, or you can go into our YouTube channel and see it. And you can also take the quiz anytime you want for this session or for past sessions if you go back and view those on our YouTube channel as well. Make sure to subscribe to our email list and check your social media for all the updates on our upcoming sessions. We are booked through June, which is pretty amazing. So we have a session every weekday until June. I hope I can see you guys there. So come and join, sign up, and get your virtual shadowing hours. So I just want to say one more time, thank you so much for joining our session today. If you have any questions, I will be sticking around with a couple of my teammates to answer